Yes, ma'am. So we have a couple of policies that we're going to talk about tonight. The first is we're revisiting policy 251 that about students experiencing homelessness and foster care and their and other educational instability and their graduation rights. If you remember last time we met about this, there was some confusion I had about whether or not the regular IEP laws had changed so that students could graduate or should graduate whenever the IEP team decides they should graduate. So I was right and wrong. That is the guidance, that they should graduate whenever the IEP team decides that they should. However, if that IEP team decides, and if the parents, stick with that, they can now stay until they're 22, not only 21. I included the guidance here for you to read and review.
Is that the year they turn 22? They're in for the whole school year.
No, I think it's the year that I think it's whenever they turn 22, they exit at that time. So this includes students who turned 21 and exited during or after the 2022-2023 school term. However, they can stay in school until they turn 22. Once they turn 22, they have to exit. However, people are not happy about this, and they're going to fight this, because what this does is put school districts in a situation where we may actually have to add staff because you have so many people staying. We might not be able to staff that. More to come on that, but that's the current recommendation.
The trouble with it really was the timing of it. I think, they made this announcement a week after school started. So prior to any real budgeting season or anything like that. So I don't think it's going to affect us too much.
This mandate didn't come with any funding.
No, it came with no
That's
funding.
the second problem.
Right. Right. So I don't think it's going to affect us.
Surprised.
As of right now, I don't think it will affect us too much. There may be a student or two that would elect to come back and enroll with us. But outside of that, I feel bad for the schools that have had a massive amount of students that graduated last year because of them being 21. So it's just the timing of it that was the biggest issue.
So the big thing where I got hung up was parents do not have the automatic right to override a NORP. They have a process for that. They can appeal it, and they can go through the process to appeal that NORP through legal action. However, if the IEP team decides that the student is ready, they've met the qualifications or the requirements of their IEP and should graduate, and that's the recommendation, the parents would have to appeal that and go through.
And the way that it is worded right now is that PDE will reach out to students that exited due to age at 21. So they are going to reach out. It's not on the school district to reach out. PDE is going to reach out. So we'll see what comes.
So
That's a nice change, isn't it? That you're not having to do the.
Well, I mean, I think that's their way to ensure that everyone is being, because if they leave that up to the school districts, a lot of school districts are going to say, well, we don't want to,
Yeah.
spend money. So
it was an interesting little rabbit hole that we went down when we tried to figure out what was going on here. But regardless, the original policy 251 specifically addresses only students who are experiencing educational instability and have an IEP. And they absolutely have the right to stay in school for as long as they need to stay in school. This policy is also mandated, so we don't really have a choice, but I did want to find some clarification about the questions we had, which now we have. So we recommend that you pass the policy as written.
Comment? Okay.
Okay. Policy 317, number 2 there is a recommendation by the administration. So this is, policy 317 is about staff behavior. And what this is about is when a staff member should notify the superintendent about an arrest or conviction of a crime. This came from a situation we were dealing with, a personnel situation, which we can't talk about here, but we had a discussion with the union about whether or not they should or they shouldn't. And the union's response was, well, it's simply not in your policy. We're correcting that. We're clarifying the policy and making it a little bit more direct about if you get arrested for any crime, or you need to notify the superintendent. However, you will report, also fill out the required paperwork for crimes enumerated in Act 111, which are very, very specific. So, and the reason for this is simply for us, so we don't get blindsided by the newspaper. Like, we're sitting here on a Tuesday and the Gazette reports that one of our teachers was arrested for something and we have no idea. We're not, we don't want to ever be in that situation. So anytime any teacher or staff member of any kind is arrested, they have a responsibility to notify my office verbally, a phone call or an email or something like that. So that's really all this policy is changing.
I'm surprised we didn't have that already in place.
We did, but it was just a little bit ambiguous. It said that any crimes that were necessary to be reported under the law,
Uh-huh.
but it didn't necessarily identify which law or which crimes. So we were saying, well, if you get arrested for any crime, it says any arrest or conviction, you need to report that. And they were saying, well, it says, mandated reportable under the law. So we added the piece where you're going to notify us no matter what. And then we added which exact law they're talking about in the second piece. So that's really the only two changes. And I think, and again, we were working with the association when this all came out. So, we know that they're aware of it too. And they basically told us to do it. So,
Jerry?
any
Will the
questions
new
about
language take care of suspended licenses, driver's license?
it?
And the reason I'm asking
For
is,
speeding?
well, for whatever reason,
Yeah.
and the reason I'm asking is, there's probably occasionally, there are teachers that travel from school to school to school. But if they're traveling on our time and they don't have a license and they're in an accident, I'm sure the school district will be drug into it.
Mhm.
Yeah.
Or we've got people driving
Or they could be taking kids to
students to events.
wherever.
I think the policy would take care of it as long as there was an arrest. Like if there was an arrest, what the policy is saying is if there is an arrest, you have to report it within 72 hours.
Yeah, but if it's just because you
Yeah,
got
but
to be
you
speeding.
So
don't
Yeah.
lose your
Speeding tickets.
license until months and months later after the
If you get a
So-
ticket or a fine
arrest.
for driving intoxicated, I mean,
That
that's
would
So
something.
even
That
if
would
you
be
just
an
have
arrest.
too
That
many
would be an
speeding
arrest.
tickets and get too many points, you
Right.
can lose your license.
But they could notify you were stopped for a DUI and they think they're done. But they may not lose their license for 3 or 6 months or something.
Mhm.
And
Yeah, I don't think the policy specifically addresses that. So if they would lose it through a non-arrested or conviction way, we would never know about it.
But right, well, and maybe to look into if we could put
Absolutely.
that
check.
in somehow.
Yeah.
Yeah, I think so, especially with the liability of driving without a license with kids in the vehicle.
Right.
Or during the school day, as you said.
Yep.
Right.
Good catch. Anything else?
I had a guy that worked for me. that Lost his license and I didn't know.
Speak from experience.
Yeah, yeah.
That's, anything else? I'll check with Ron, we'll follow up and we'll bring it back to next time for more information.
Number 3.
All right, the creation of an LPN position. We had a resignation of a CSN, that's a certified school nurse. So the certified school nurses oversee the licensed practitioner nurses who see a lot of the office traffic. We had just recently decided, if you remember, in the summertime, we had talked about maybe hiring an LPN, and then we came back and had another discussion. We decided not to hire the LPN and just kind of rearrange the LPN and CSN coverage through the district. But right after we did that, one of our certified school nurses resigned. She got a different job in a nearby area. So based on the feedback we got from the nurses about the way we realigned them, we had a meeting with, Jared and I had a meeting with the remaining CSNs and asked them, and we had a conversation about should we maybe hire 2 LPNs instead of hiring 1 CSN. Benefit here is we get 2 for basically the price of 1. The problem is that the CSNs are burdened a lot by being in the office and then having to do all the documentation and all the reporting that their job is designed to do because they don't have time during the day. So they're constantly doing work outside the regular school hours day. The LPNs can't really help them with a lot of that reporting because it has to be done by a certified school nurse. So what we're asking to do here is if we hire the 2 LPNs, each building will have its own dedicated office nurse that will handle all of the foot traffic all day long. The CSNs then, the three CSNs will just cover the entire district. They'll each divvy up which grade levels they're going to cover and oversee the LPN's work, if that makes sense. This is going to give us more help, which we need. It's going to alleviate some of the concerns that the certified school nurses had, because they now will have the time to do the work that they're designed to do. And it'll help the LPNs, because the LPNs weren't happy with the way that we rearranged everyone to cover the district. So it's a win-win there. And then on top of that, as I mentioned, 2 LPNs cost almost exactly what a CSN costs at entry-level rate. So if we hire somebody with any experience or an advanced degree, the CSN is going to cost more than the 2 LPNs. And then over time, the CSN's costs increase significantly faster than the LPN. So now it's a win-win-win. So it's a win-win for the nurses and the LPNs, and it's also, we get to expand our capacity and lower our costs at the same time.
So every building will have an LPN.
Every building would have an LPN.
And then the CSNs, just for the public to know, that you
Sure.
don't just have 3 nurses. What are their duties?
Their duties are to
They've got
write
tons
health
of paperwork.
plans, tons of paperwork. So if, let's say you have a student with diabetes, that student with diabetes has a primary care physician who gives orders. The nurse then has to take those orders, turn that into a health plan that is communicated to all the teachers and the cafeteria workers and the principal, and make sure that that's all good to go. That's CSN work. The LPNs can't do that. So a kid comes in with a boo-boo, the LPN will handle that, take care of it. The CSN, well, the LPN can actually document that. That's a bad example. But if it's a more significant health concern, the CSN has to document what went on there just legally. So the CSN is more of almost, I don't want to say administrative, but that's a lot of documentation and compliance with the law, where the LPNs or either of the nurses can handle the traffic that's there every day. Does that make sense?
Yeah,
They do. Poor job explaining
that's
it.
not enough though.
Okay.
So what else do the CSNs do? Are they responsible for physicals?
Oh, absolutely.
Dental
Physical,
checks, eye
heights,
checks.
weights, eye checks, all of that is done by
Because
the
the
CSN.
CSNs can help with that, but they can't sign off on
And the
it?
LPNs can help with that, but not sign off on it.
Oh, the LPNs,
Correct.
yeah.
You're 100% right. And the way this would work right now, we're going to meet with the CSNs to get their feedback on this, but the rough estimate of this is 1 certified school nurse would oversee both K-3 buildings, okay? 1 certified school nurse would oversee 4 5s in the junior high, and the 1 CSN would handle the high school and our outside of the district partners like St. Bernard's and maybe
Cedar
Adelphi Village, those kinds of places, and that's based on caseloads. Now the
And the
CSNs,
caseloads, just so the public knows that the CSNs are not being overworked or underworked, what are the caseloads?
the caseloads here are, they're about 1,000, approximately 1,000 students per certified school nurse.
And
The
law-
What's the
I thought the
requirement?
requirement was 1,500 max.
That's correct. The requirement
That's-
is 1,500 max.
So we
So
have 3
We have 3
certified
CSNs
nurses.
for 3,000 plus students, just right around 3,000 students. So we're,
We're under.
That's our actual load. We're permitted
Right.
1,500.
Right, so
But
we're not overworking them, but we're not grossly underworking them. That's all I wanted to get across.
it's right about that sweet spot. 1,500 is what the law says.
Yeah.
But 1,500 is pushing the limits of what one CSN
But
could
that
handle.
also means that we have a capacity of 4,500 and we're not anywhere close to
We're
that
nowhere
number
near that, sorry. Yeah, but
with our population and with the outside populations that we have.
that's correct. We're well under that.
Yeah,
Absolutely.
so we're not gonna have to, at some point in the future, we're not gonna have to replace the certified, we're not gonna have to go to 4 certified.
No, 100% not. We were overstaffed in this situation. Now we'll have the LPNs in place, and once we go down to 1 less building, we can reassess the situation there. But we'll be okay.
Okay.
Historically, we need to make sure that the LPNs know what their job title, what their job responsibilities are. Certified school nurses know what their the district got in trouble a couple decades ago when they allowed the LPNs to do certified school nurse work. And
Correct.
There was a judgment against the district of several $100,000.
Yeah, Jared and I met with both the CSN and the LPNs, school, went over a lot of that, worked with them as a team to try to solve the situation of coverage that included a lot of their job description stuff. So a lot of that's where this came from, this information. They got to share with us a lot of the things that they were unhappy about and frustrated with in their job.
But
So-
those job descriptions need to be written down, and the LPNs need to prevented from school nurses can't be sloughing off work on the LPS.
Yes, sir.
Oh, yeah.
We,
Anybody else?
is someone,
Someone's not.
Yeah, Sally McCombie's pushed the wrong button or something.
Dr. McCombie, can you mute your mic, please? Oh, thank you very much. We appreciate it.
Just gonna text Randy.
That was cute.
I couldn't from here.
It's okay.
Okay,
Yeah,
number
but there-
4?
Number 4 is to review the health and safety plan, and this is, so ESSERS, if we are receiving ESSERS money and paying, using that ESSERS money for things it's designed for, we have to have an approved health and safety plan. We have an approved health and safety plan from last year that's still in effect. It needs updated. I got some guidance from Mr. Repack that basically says, listen, the COVID reporting protocols that the old health and safety plan is based on are no longer mandates. They are, and I shared some of that documentation with the board earlier. And basically what he's saying is we shouldn't necessarily identify COVID-19 and isolate COVID-19. We should have a health and safety plan that covers all communicable diseases. So flu, RSV, whatever it might be. Any communicable disease could fall into that category, whooping cough or anything.
But we, as you said in the thing, we already have that where if you've got a fever or whatever, you don't come back for 24 hours.
Correct. So that's basically what his recommendation is. Recommendation 1 was that we're not the COVID police anymore. That if a student comes in presenting symptoms, we simply refer them to the doctors, let the family primary care physicians test them, give them a recommendation, and then we just ask the families to share with us what the doctor recommends, which takes that off the plates of our nurses who, as mentioned in the previous thing, are already overworked a little bit, or at least, had a lot on their plate. So that would be a very welcome change, I think, because they're not doctors, right? They're nurses. They are used to following orders, not doing all this stuff. Our CLIA waiver has expired. We don't feel the need to reapply for the CLIA waiver. The CLIA waiver is what allowed us to do the testing. And our tests that we have from the government are all well out of date. They were actually out of date when they arrived. So they've expired. So we don't feel comfortable either applying for the CLIA waiver or using those tests. Now, the nurses are checking with the Department of Health to see if those tests are still viable. If they are, we'll give them out to people, say, hey, please, here's a free COVID test, please take it, put it to good use. But if they're expired and they say throw them away, we're just going to throw them away. So I think that's step number 1. Step number 2 is if you have COVID-like symptoms or flu symptoms or any other symptoms, you need to be fever-free for 24 hours without the use of Tylenol or aspirin or any other fever reducer for at least 24 hours before you come back to school. That's good advice no matter what you have. And I think and what Mr. Repack's advice to what his firm's advice to their clients is you follow this because that's good practice. It's good practice in the medical field. And I think Dr. Shaver could attest to that. But that's something we should be doing no matter what. If you have any kind of illness, fever, stay away until you're fever-free for 24 hours. That will take away from unnecessary exclusions from school. That would take away, that'll, again, put the onus off of our nurses and more in line with on the physicians. So it takes us off our purview, puts it on theirs. And that, again, that last recommendation is that we change that health and safety plan to cover all communicable disease. So my advice is, and we can do whatever we want, is we put this plan in place where we say, this is our standard operating procedure. Number 1, if you have symptoms of any of these, we're going to refer you to a doctor and have the doctor make the diagnosis as they're trained to do. And then the doctor can tell us how we should treat it as the professional that they are. Second thing, everyone is going to be, we're going to blast again and again and again. If you're sick, stay home. If you're sick, stay home. If you're sick, stay home. How long should you stay home? Until you are fever-free for 24 hours. And then if there is an outbreak, we'll continue to monitor our numbers. We have the system set up. We may need to tweak the system a little bit to differentiate between flu and cold and COVID, but we can look at the number of students who are out for whatever reason. If we have an outbreak of anything for any reason, that initiates the health and safety plan and we go from there. That's my recommendation, and we can use that same metric of 5% with the rolling average over 10 days, if that makes everybody happy. If you want to just, pick a hard number and go for that, I mean, we can discuss that, but that would be my recommendation.
Do you know at what point, how many students, at what point is the reporting to the Department of Health triggered? So if we have Horace Mann with 30 kids out with cold and flu symptoms, does that get reported? Or
It's not a
when do we-
mandated report anymore, so we don't have to
No.
report it, but yes, but
But-
I don't know the answer to that, like
I
if
mean,
there's a
like, if
magic
it's whooping
number.
cough, the
Yeah.
health department finds out about it,
Yeah.
how,
That's
Yeah, when-
from the lab side of things. That wouldn't come from
Okay.
the school. So there are certain diseases still from the hospital lab. That's where that CLIA waiver is important. If you're testing people for stuff, you have to be an approved site. So when that information gets passed to the Department of Health, they know where it's coming from.
I see. Okay.
So as a lab, like even in the emergency room, we can't use those instant tests. We have to send our sample to the lab in the hospital because they have the license to actually do that. And whooping cough, pertussis is on that list of reportable diseases. So if there was an outbreak in Indiana, we would know that based on the testing, and that would go to the Department of Health, and we might hear something from them directing us to do something. But when I talked to Rob earlier, as a school, I think we need to get out of the health business and stay in the teaching business because we're not equipped to test for that stuff. Even when we were testing for COVID, we weren't testing for everything else. So little Johnny's got a fever. It's not COVID. He's fever-free, comes back. Well, what did he have? That should get punted back to the doctor to get a diagnosis. That's the only way that kind of stuff gets
But
Yeah,
followed up.
Well,
that
What
leads to another
happens-
question.
what happens when I get sent home, and I'm supposed to go see the doctor, and my parents elect not to do that, which
Or
will happen very
either don't
commonly.
want to or
That
don't
there'll
have
be
the
no
means
medical-
to.
Mhm.
Professional involved.
Which is always a risk, but if you come back to school and you're sick, you're visibly ill, you're gonna get sent to the nurse.
100%.
If
And you'll be
if
sent home
you're
again.
fever-free, then you're fever-free,
Yeah,
yeah.
I understand that, it's just, we can't make it, the policy rely on the assumption that they're going to see a physician. That doesn't, I guarantee you that doesn't happen.
But we're also not
Well-
licensed to be a physician, so we can't stand instead of that.
Well,
I think what we're doing is the nurses go back to being nurses.
Right.
They're not going to diagnose you. They're going to say, I'm sorry, Tom, you have a fever. You need to go home. Call mom and dad. Mom and dad, he has flu-like symptoms, could be COVID. We recommend you go get him tested. Have the doctor share those
And I
orders.
go home, but I don't come back with a doctor's excuse, I come back fever-free.
Mhm.
Okay, I mean,
Then,
that should be the trigger.
Correct.
Okay.
That's it. If you're
I mean-
24 hours fever-free with no fever reducers, you're welcome back. That's, because then.
may I make a suggestion?
Yeah.
Okay, you said 30 kids out for Horace Mann. Since kids spread absolutely everything, there's no way to tell if it's a cold, fever, or COVID.
Mhm.
So if it gets to that 5% point or whatever, may I suggest that we have a few of the kids go to the doctors and bring back a doctor's excuse on whether or not they've been tested for COVID. So that way we know what outbreak is going on in which school.
So you're saying if.
That way we don't overreact and get everybody shut down because of COVID
Mhm.
when it's just the cold.
I think if we get to that point, if we monitor the numbers and we get to a point where we're having a lot of kids, not coming to school for illness,
Mhm.
we can reach out to the Department of Health at that point and ask for further guidance as well. Is this an outbreak? Is this, and we can work through that at that
Yeah.
point. Like
Yeah.
before
I
COVID
think we should
happened,
just track all general health-related misses. Because even if it's an outbreak of the flu, I think we should handle that just with the same severity we did for COVID. It's just as dangerous at this point. We need to, if it's gastro, you get a bunch of, people puking and pooping, and you get 50 kids out of Horace Mann, it's the same thing. I think,
could be transmitted more through
we should
COVID.
track illness misses,
Mhm.
in general, and leave it to the Department of Health to direct us as far as our, where
And-
our
and for what it's-
And we can track that.
Mhm.
When the
Right.
nurse sends 50 kids home,
Right.
we know that the 50 vacant seats, we can track that. And if that's 50 out of 200, we need to get
That's
serious.
25% of the school. It's already shut down at that point.
For what it's worth regarding the CDC stance on this, on the page that they used to have considerations for school closure, when you click on that same link, it says now, considerations for school closure PDF is no longer being updated. Please go to cdc.gov, and it takes you back to cdc.gov, which is just their general site.
Welcome to America,
So there is no
people.
recommendation on school closures anymore either.
I have one quick question too. In
Sure.
your email, you said that whoever the attendance people are, that we're no longer going to use an SP designation. What is that?
Yes, so that was how we reported to the state how many cases of COVID we had. So in Power School, if you were out sick, you have one code in Power School. If you're out sick with COVID, you got a different,
No,
Like if
so
you were
you're just
excluded-
streamlining it and stuff.
yeah, it was like a different, and we're
Okay.
just gonna get rid of that just to make the attendance a little
Right.
bit easier as well. But then the reason I like this is it takes that onus off of
Right.
our medical professionals, puts it in the hands of the medical professionals. It should be with the people who are trained to diagnose and treat, and then they can tell our nurses what to do. They're gonna be responsible professionals. If there's a COVID outbreak, they'll tell us, look, hey, this is what's going on.
But the trigger is if I'm fever free for 24 hours, which is a mom thing.
Yep.
You know, a parent can determine that
Mhm.
and send me back. Okay, so it's not a situation where it's not a concussion protocol where I have to get a doctor's excuse.
Mhm.
And it allows our parents to be parents.
So,
You know, when little Johnny is
Right.
fever free for 24 hours, send him back to school,
We do
regardless
have
of what he has.
to, we do have to remember though and be aware that there were kids being sent to school
Sick.
during COVID with fevers who were caught at the door, first day of school by the teachers or the staff, because parents either couldn't or didn't want to, but the parents, I think we should still send them home. I mean, you've got a fever, you get sent
I'm
home.
not saying, yeah.
And you come back without a fever
Yeah,
and
you
that's
come back,
it.
yeah, if you're fever free,
And I think,
please come to school.
Is there a way to trigger the nurses if Johnny gets sent home Monday and he shows up Tuesday? Is that gonna be on their radar to maybe check his temperature and see how?
oh,
he's doing?
100%, yeah, they'll be all over that. They'll send
I
them
think
home
that's good.
right away
Yeah.
again, you know? So
You know,
it's-
Because
It would be 24 hours, so it already raised a little suspicion,
Didn't
yeah.
have the ability, needed those kids to go to school because they didn't have daycare. I mean,
Yeah.
There
Oh,
are
Man,
situations.
there's gonna be motivation, yeah, hey, my kid plays in the playoff game this Saturday, you don't have COVID, you know what I mean? Like, there's gonna be that mentality that we're gonna have to deal with for sure. And, you know, we just have to, I mean, we'll have to deal with that however we have to deal with that. But as far as our nurses doing that work of policing it, testing it, you know, mandating exclusions and stuff like that, we take that off their plate. We give it back to the doctors where it belongs. And then if there's an outbreak, however we want to determine that, we kick in the plan and we change the plan to say COVID-19 to say any communicable disease. Wherever it goes through and says, you know, COVID, we change it to any communicable disease. You know, and that way it's good for no matter what the next pandemic is.
Can I make a suggestion?
So-
Can I make a suggestion? If a parent sends their kid to school with a fever
Mhm.
and the nurse has to catch the kid and send him home, can at that point we say, okay, we'd like to see a doctor's script, because if you're willing to send your kid to school sick, there's no guarantee. I don't want to have the CSNs having to chase down kids to order to take their temperature when they come back.
Mhm.
You know what I mean? I want Parents take some responsibility at that
I
point.
want the kid in school, and the chances are that kid didn't see a doctor, isn't gonna spend $150 to go to some Med Express. Okay, I mean, we have to remember that 50% of our kids are eating lunch for free.
No, I know, and I realize, believe me, I don't go to Telexpress unless I'm losing an arm. But there's telemed and stuff like that. Or I think that if a parent knows that their kid is sick and they've got a fever and they send them to school anyway, because they don't want to pay for daycare or they don't want to take off work, there should be some responsibility on the parent's side to do their own due diligence and not have us chase around their child for them.
You can say that, but it's, we're punishing people who can't afford the medical care.
I'm not saying that I never had a child with a sniffly nose and didn't go, okay, you're fine. You're fine to go to school. I'm saying that there are parents that you know your kid's sick. If you send them on to school, is that the school's fault or your fault?
There's no way to mandate that, is there?
No.
I don't know that we
mean,
can mandate it.
Is
Tammy,
there,
I
are there
went to
any
school.
avenues
Huh?
I went to
for
school with
helping
fevers all the time. I used to get strep throat when I would
families
go
that
to
don't have
school.
money?
Go to school
Is
with
there
wet hair and it
anything
would
that-
freeze. I mean,
Like if some.
Did you see the kids coming home from junior high
I'm sick, I don't go out of the house.
January in shorts,
Insurance,
tank
we don't have
tops?
the money.
Yeah.
Is there anything?
I mean, they can definitely hook them up with chips and those things that there's
Long
free, there are
pants
free
drawers,
healthcare
the most
programs out
pristine
there.
jewelry
that nurses
has.
and employees can help them.
They can,
Same with my daughters. So it's like,
100%.
really?
That's,
So
I will say, for what it's worth, I don't believe there's any way that you're gonna have a kid come and be able to do it. However, I will tell you that we are regulated where if we have seen a student who's come to school 3 or 4 times in a row, like the whole week they come and they're sick, we would file a CYS complaint for neglect against the parent. So there is mechanisms in place to make sure that we can
Okay.
enforce the doctors or physicians.
Well, there's a
take look
mechanism
at
too
it.
for absenteeism. If you miss too many days, you have to have a doctor's note.
Yep.
You know, that-
Yeah.
Yeah, so I don't know about the one time, but if it is a pattern, there's no question we have mechanisms in place that we enforce pretty regularly.
but our nurses know to let the parents know that there are avenues for,
100%.
to
Yeah,
give
they're,
free help.
Especially if
Yeah.
they're, I mean,
Yeah,
you could have
they're
WIC,
experts at
CHIP, things of that nature.
and now they'll have
Although
more
those
time.
Resources are
Taking
dwindling.
all of this contact tracing and contacting
Right.
parents and going through all those protocols off their plate, they'll have more time to be more attentive to these individual situations, you know, which is a good thing.
Last word, Walter.
yeah, so Tammy, you talked about, what happens if we get to, 30 kids or whatever in a building or 50 kids or whatever. It seems to me that we have on a retainer a physician,
We do,
school physician.
we sure do.
Yeah.
Okay, and so it would seem to me that if those cases rise to some level, that maybe the appropriate thing to do would be, again, to your point of keeping the doctors more in control of this thing, before you go to the health department necessarily, would be to pull that
Position.
physician into the discussion. Maybe they could do some tests or order some tests or do whatever to help get us through that process.
It's not a bad point, but I would do both at the same time because
Yeah.
it's blanket on her name.
Christina Lubel.
Lubel. She would have a percentage of the population. The Department of Health is going to know the results of the local area tests without. Dr. Lubold is not going to be able to tell you Johnny's COVID test. That's protected health information.
Yeah.
But the Department of Health is going to be able to tell you, we have a 10% positive test, rhinovirus. And they're going to know that. They're going to know that immediately within a day. They'll be able to tell you that. So they're going to be the better resource when it comes to public health. Dr. Lubold would be able to tell you anecdotal stuff, kind of like I can tell you anecdotal stuff. You know, I know what I'm seeing in the ER when I work there. She's going to know what she sees in the office, when she works there. Her general patient population, it's not going to be completely representative of, our outlying patients that don't go to her. So I think she's a good resource to tap, but I wouldn't ignore the Department of Health. That's what they're there for. And that's what they bring to the table. They're going to be able to tell you, in this community, we have a 10% positive rate of this. We have been seeing this. We've been seeing a mixture of this and this. They should be able to tell you that very, very quickly. That's what they do. So,
Okay,
I think they just got overwhelmed when COVID hit.
well, everything was COVID. Like I'm dealing with it now with all the new residents that are coming through Clarion. They don't know anything if it's not COVID. And when you do see a COVID, they want to go back to 2021 COVID, and you can't even treat it like that anymore. You can't. Like no, they want to give remdesivir. Remdesivir was a failed Ebola drug that was pulled from the Ebola study because it killed more people than Ebola, which kills half the people that get Ebola. And we were giving it. I gave it to people, and you didn't know any better. That's what they told us we had to give, and we know so much more now than we did back then. It seems ridiculous how we handled it in 2021.
so then the approval of this is on the agenda for tonight, if I'm not mistaken.
It is.
And so then do we just simply not read this and then get some of this change work done, bring it back either to the committee or a board.
I was editing while you were talking.
Were you
So,
well, then I'll just,
multitasking?
I'll ask you to be quiet.
I mean, so we can just approve it as presented, right? Because we've discussed it. If we incorporate Ron's
Yep.
legal suggestions,
Correct.
then there wasn't anything else to really change.
So what I did was I took Ron's suggestions, I put them at the top. I said, here is our standard operating procedure. Should an outbreak be determined of any communicable disease, be determined to be occurring, the following plan will be implemented. Saying the plan that we presented, and then I went through and searched where it said COVID-19, and I changed it to communicable disease.
Yeah.
So it's a good start, and then if we need to tweak it as we go forward, we can always tweak it as we go forward.
Yeah.
And,
So we'll leave it on the agenda then for
leave it on the
tonight.
agenda, but we'll
Is
have that
everybody good
amended.
with it
Yeah,
that way?
this will be the,
Yeah.
Everybody's okay with that.
I think that's,
so you may have to change
get a
it
lot more
to,
mileage out of it.
Yeah, and that's something I think we should have been doing all along, and then when we got COVID and they said, do this and then keep it because you're gonna use it, because how many kids, the reason why little kids spread everything is because they go to school sick, and, those things spread,
Mhm.
so.
so we may have to just pass the motion as, approve the health and safety plan as amended instead of as presented, because I did amend it. And I'll share that with you all right now, so you have it.
Okay.
Okay, and then I may have to go just through and make some edits in case any of the COVID-19 communicable disease isn't fixed right, but we should be okay with that, right? Just like little
No,
grammatical
it's in
things.
Tom's, it's in your section,
Okay,
I don't know why my section-
as amended,
We have to move it to this section.
you can do it. Okay, last item, please.
last items, we have a nursing practicum request from a student from Eastern University who lives in our area, is seeking a practicum. So apparently, if I understand this correctly, she's taking classes that are online, but now the practicum has to be an in-person thing. She needs to do both elementary and secondary experience. So we are one of the schools around here that have elementary and secondary certified school nurses. So she has to do 60 hours with them. We've worked with Eastern University in the past. They are accredited. We checked into that. So we're asking to approve this. So she would spend 60 hours, like 30 hours with our secondary nurses and 30 hours with our elementary nurses, learning how to be a certified school nurse. So it's actually a little help for us and help for her.
Any objections?
Okay.
Non-agenda items.
No, agenda item number one is we are going to be seeking outside agencies for behavioral support services. And we will be bringing bids. We could be bringing bids later. So do you want to talk more about that one, or is that?
Yeah, we have a shortage. Terry, you could probably tell me the exact number. There's a shortage.
2 to 3 paraprofessional positions.
Paraprofessionals? Yeah, that's what this is about.
So we have in the past, when we have no applicants for the paraprofessional positions, we have looked at some of the third-party agencies to see if they could help support staffing. With there being 3 down now and sitting on 0 applicants, we're just looking to see what outside supports we could possibly find. So, we could, if you're okay with it, we'd like to reach out to
Silver lining.
Silver Lining. There's FBR.
Mhm.
There's a few different behavioral type agencies that we could search. See what kind of prices are out there. But we wanted to bring that to you guys just before we even talk to anybody.
I have no
Sounds
problem.
acceptable to me.
Yeah.
We have
Because we need them.
Yeah, we have had, it's a little bit different, they'll hire them as behavior support professionals, but in our autistic support classrooms and our life skills classrooms, they could certainly need, use the expertise of folks with
So
behavioral
would these
backgrounds.
people be assigned to our school, or would it be like Kelly Services?
Yeah, they
where
would
go
assign,
to
assign them to our
Ridge one
buildings.
day and,
And we do right now have a contract for 3 staff persons from FBR that do work within our autistic support classrooms right now. So it would just kind of be like a continuation of that.
And obviously, we wouldn't do it until we brought it back for final approval. We wouldn't enter into any agreement with anybody until you said yes.
I'm good with it.
Number 2.
All right, and this is back to basics discussion. This was a request by the committee, so I'll turn it over to you guys if somebody wanted to.
I'm gonna turn it over to Terry.
Yeah. I know we've thrown this phrase out over the years, now since I've been on the board for 6 years almost. I just have a feeling that with the upcoming Eisenhower project and a lot of other maintenance and building needs, that we're going to continue to be looking for how can we spend our money more wisely. And then that's one part of this. The other part of it is I sort of live by a philosophy that experts are experts. You know, if I have if I have some type of disease and I want to go to some doctor and it's a rare type of disease, I'm going to go to a specialist, you know, because they specialize in maybe that disease. And then they're usually good at that. And I'm afraid that over the years, we just keep throwing things on the wall in this district. Almost a lot of times when an idea comes to this board, it's like, okay, let's implement this. And it puts a lot of stress on our staff. I think that and then I guess the third spoke of this wheel too is we keep hearing in the news about what a poor job we're doing teaching our kids to read, write, and do math, and some science and stuff like that. I usually pick my restaurants too. Do they specialize in certain things? And that's where you end up going. You know, it's hard to be good at everything, and it's expensive to be good at everything. So, in a way, since I brought this up, I wish I was maybe on the general ballot in the fall. I'm not, though, because this is going to take some time if this board wants to pursue this.
There's always room for volunteer help to assist in this, Terry, so I'm not sure we can figure that out.
Right.
Sounds like
And
we're
it's-
talking about academics.
It's just not academics. It's sports. It's whatever this district does. Let's brainstorm what our core functions should be. What outcomes do we want in whatever, you know, whether it's curriculum or academics or, you know, sports or whatever.
Terry, I don't have a problem with taking an in-depth look at this. But we may want to pick a different title for the topic, because right now, Back to Basics has some political connotations with it that may go beyond or may not be what you're trying to get done here if we're going to try to take a look and see what we actually need to.
And I don't read that into it, so I'm not sure what you're saying.
So
Well,
I don't want to
Back to
told you that.
basics is a movement, basically, or was a movement. So
Yeah.
that's why you don't want to call it that.
Yeah,
okay, and the
Movement for what?
Or back to the basic reading,
Writing,
writing,
arithmetic.
arithmetic. Yeah,
Right.
the old basic.
that's mine.
Yeah.
And
But it
my
gets
thing,
people's attention though, too,
well,
right?
yeah, but,
Well, good
and-
and bad.
yeah, but, and
Some
the
of that
community
attention
needs
may
to be
not want.
educated. We are a public school. Our job is to educate kids. Our job is to teach them how to read, how to write, how to do math,
And we're doing.
how to live in a
this for job
society.
of it.
Our job is not necessarily to teach them how to do yoga or fly drones. We need, and my thing is, if we do back to basics, the 3 R's, if we do what we are supposed to be doing, educating kids, my goal would be every kid can read, every kid can do basic math, every kid graduates. That's the overarching, and every kid swims. Those are the
He gets a driver's license.
I don't care about the driver's license, but if they get it, then they need to have driver's ed. But that's the thing. And I think that's what Terry's kind of alluding to, that to do that and do that well takes time and money. But every time we get some money, it's like, oh, let's do this, let's do that. And we still have a significant number of kids leaving school not able to do those basic things that you need in life. And that's just wrong.
And half of our students might not be able to afford to do those other things.
Right.
And we're,
Yeah.
we're sort of, I think we're dropping the ball on
Well,
whatever we
And
want
we've
to
got-
call this thing.
Okay.
And we've got a changing population
We call it
base.
core, we
right,
call it
economy.
something else, but we call it back to basics. Back to basics also has a political connotation about religion in the schools, about prayer, about corporal
Okay, so
punishment.
call it something
Yeah,
else.
Yeah, I'm okay with that.
The
I-
title is
yeah.
really useful.
I don't get into all that stuff.
And-
So I,
and we don't
I
want
think
to.
you're
I wanna-
right, Terry, about letting the professionals
go to the phones.
do their jobs.
Yeah,
You know, we are here to teach, but we also, I mean, we can't not look at the mental health issues that are going on right now.
Right.
Because kids aren't going to learn to read, write, and do math if they can't focus or concentrate because
And that's
they're having.
what
other-
that
So-
back to basics movement is, but I
So-
don't think that's what
So
Terry's talking
Tom
about.
sent out a couple months ago, 3 or 4 different articles that he had come across that addressed this. And the one article I was most impressed with, because it kind of talked about the concept, well, we need to go back to the way it was back in the 40s and the 50s and the 60s. Okay. But no, hear me out. Okay.
I could read, right,
Okay.
do everything.
The point of the
My
article
grandparents
was
could too.
that there was, that it wasn't just reading the 3 R's back in the 40s, 50s, and 60s. There was also social aspects of it, behavioral aspects of it in the classroom, the respect for different people, and the point of the article was, when you say back to basics back in the 40s, 50s, and 60s, understand you're not really simply talking about the 3 R's, but you're talking about that bigger picture of the whole student. And I think if that really impressed me, because I think that's really where we need to be on this thing. Okay.
So
Then
what
we're
do we,
public education for all students.
So
Education for all, and make it
so
education.
so to I'm sure that Justin will be blessing me here afterwards. Okay. But maybe we need it to do what you want to do. I think maybe we need to have our director of education kind of do a strategic plan or go through a strategic review of what we're doing educationally and how we're actually doing it. And are there some plans that we need to, there's some things we need to do differently? Okay. Or there are some things we need to keep no matter what.
Yeah.
Okay.
and I think,
But
Sue, were you insinuating or suggesting we look at the sports too, or what were you thinking with your comment?
Yeah, I mean, I think you're right. We need to look at everything
Mhm.
across the board, but I think the academic committee should, is a good place to start with the academic side. And of course, we are academics and extracurriculars, right? Which I don't know if we should be moving forward, but that's something we can talk about at another time, because there's so much in
I
academics.
That was a conscious decision because the feeling at the time was that the extracurricular was a separate committee, and it had an undue influence. It was equal to all the other committees, was just extracurricular. So the varsity football team had a bigger voice than English did. So that's why I got put into.
Yeah.
I
I think,
think it's appropriate to be put together because you don't do extracurriculars if your academics aren't up. So they should be connected.
right, and I think, I like your idea, Walter, I think, not to put work on Justin, but I think the first thing maybe is let's get a list of what all we do, and then brainstorm what results do we want? And is this list hitting our targets here?
And I think that's what
And
we
if they're
started to do
not,
with the NCEE work.
Yeah, I think,
We looked at our where do we want to be? Where do we want our kids to be when they graduate? No matter where they come from, coming into kindergarten, where do we want, what skills and talents do we want them to have when they leave the Indian Area School District? So I think we started that work.
Mhm.
I
And
think,
I don't think, one person, Justin can't write an entire strategic plan.
No.
I mean, at IUP, there's
No.
hundreds of people and typically it would be, at a district level, probably, 20 some people that you would have write a strategic plan. or-
Sue, to just back off just a little bit, okay, I felt it was more under his wheelhouse to take the lead on it.
Right.
Yes,
You
I
said
understand.
write it. You said, hey.
Well, yeah, but-
Justin.
Okay, so I'll stand corrected
Justin
quickly
will
on
be running
that
out the door.
one.
What's NCE?
That National Council on Education and
Mhm.
Economics, that we
That-
sent that group to.
We use that as the
It's
catalyst
a
for,
benchmarking.
for us changing our comprehensive plan last year.
And you don't think it went anywhere further than, it didn't
Well,
go as
remember,
far
Rob
as
came
what?
back and asked us if he wants to train more teachers in it.
Okay,
Then we
right, I
all thought it
remember
was a
that.
good
What
idea.
if something we did was take the existing comprehensive plan back to the academic and extracurricular committee the next meeting and use that as kind of like a starting point for us to see what was listed in the comprehensive plan as priorities? And I see where you're going with it is,
Right.
it's like, if we're gonna have to prioritize, spending at some point here, right?
Sure.
So if we have that comprehensive plan would really be the list of priorities that we have. So when we're looking at things to spend and things not to spend on, comprehensive plan items would be your top sale items.
And when ideas come, if it's not in that plan to meet these goals, it doesn't get implemented.
Right.
I think Cinda's right, about
Unless
just throwing, we're trying a lot of things, and
Right.
what are we taking away?
Yeah.
okay,
Nobody
We implement
knows.
something, I
What
know
I'm
teachers'
concerned
plates get
about
so
is-
full that we keep dumping things on them, but we're not taking anything
Right.
But I
away.
want to know what the statistics are of the kids walking out the door the last day of high school with unable to read, unable to do basic arithmetic. We're still sending kids out of our buildings, and I know we're working on the reading, and I know it takes time, but we're still doing a disservice to those kids that are already in the pipeline by not jumping on that and making it so they can succeed academically so that they can be successful in life.
If we weren't
So-
spending millions on all these other things.
Right.
we'd
So
be
I think it's
putting the
good to
money-
do all of this, and it's good to start with how many kids are dropping out? And how many kids are dropping out because of grades? How many kids are functionally illiterate? And you can't tell me that the teachers don't know. The teachers know when the kids can't read.
Mhm.
I mean, and so, yeah, and it puts more on the teachers, because I've still been saying forever and ever since ICTC and the tech prep thing, that was a targeted program to get kids who were floundering and make sure they passed. And it can be done. It can be done, and we can do it with every single kid. Every single kid in our school should pass biology.
Was it like an adult literacy class?
It was a tutoring program at the technology center for the students. If they were getting a failing grade or very low grade in any of their academic subjects back at their home school, there were tutors at the technology center who would pull those kids out and say, you've got a biology test, we're gonna study for it, this is your biology homework, this is your English paper you have to write, this is the math you have to do, and it made a tremendous difference in those kids' lives, because they were successful.
okay. I'm all
So
for all of that, I really am, but I don't want to see the kids the diagnosing where we're finding the kids that are having issues and getting them the help they need.
Right.
Because that changes every year. I mean, that changes so much. I mean, they didn't believe that girls could have ADHD 20 years ago. And now, they didn't believe that adults could have it 10 years ago. I mean, it's so fluid that I don't want to have those kids who have like ADHD or touch of autism fall behind because they're not able to meet the basics of those things without the special help that
Yeah,
we
That's
can
not what I'm
identify.
talking about.
Yeah.
But did anybody read the article in the paper? Maybe it was Friday or Saturday. It was an article on the bottom of the front page. It was about income and students, how much we spend on students' equity. Did anybody read it?
Yeah.
I was shocked to see, our average, like, was it our median salary in our district is not much more than the rural districts in Indiana County. I was shocked. I thought it was gonna be
Higher.
in a big jump.
That's all a result of the union negotiator that was here in 2000. And she was negotiating for the whole county.
No,
No.
She
it had
would
nothing to
use-
do with teacher salaries. This is,
You're talking about the cost per pupil.
yes,
spending.
cost per pupil.
That's
People
80%,
spending.
that's 80% of our costs.
But what I'm talking, I think you're missing my point, Tom. It was a relationship between what the average income was in the school district and the cost per student. There was some other school districts, Freeport was one of them. Their average salary, salary was like 20-some thousand higher than Indiana's. But our district salaries, average salaries, were only like a couple thousand more than Penn's Manor and Purchase Line and, United and Marion Center and stuff. And I was really surprised. But that goes back to the 50%
Yeah.
free and reduced lunch.
Yeah, I'm gonna-
Yeah.
So a lot of people think we're a rich district,
No, we're not.
and we're not.
When you talk about average salary, I'm not sure how to calculate that. But the majority of our teachers are at the maximum.
It's not a teacher salary.
He's talking about
It's
cost
not teacher salary.
Community salary, not teachers.
He's talking about your salary, my salary.
Our population of people.
My
makes a couple
non-salary.
thousand more than.
Has nothing to do with teacher salaries.
That's why we have 50% free and reduced lunch.
Right. And that's why we're putting things like.
And that's why I'm
MTSS in.
talking about, whatever we're talking about,
You're opening that door for me.
Mrs. Broad's point, make sure that every single student succeeds. That's why we have these systems like MTSS. Like before, if you didn't pass it, we just move on.
Yeah.
Right.
And now you didn't get it the first time. Okay, now you're going to spend more time with someone who's going to try to accelerate your learning and catch you up so that you stay with your peers. Because once you start falling behind, you end up into that spiral downward. And then once you end up with a later on, you're like special education, learning disabled, your outcomes are significantly lower than your peers without that same
but we're gonna be
diagnosis.
spending a lot more money here in the near future if we borrow more money, safety and security. Our buildings need a lot of work, and I don't know how the families in our district are gonna be able to afford all this. So it's just a thought or an idea, proposal for us to look at our core functions, see what
Derek?
can be cut, what we need.
We've come through probably the most difficult time, I think, in modern history, in education, when we went through this COVID and the impacts of it. And we did a lot of things quickly, and as you said, as soon as an idea came up, a lot of times we adopted it, but a lot of times that was reactionary to what we were faced with. I think organizationally, it does make a certain amount of sense that we sit back now that things have returned somewhat to normal, and to sit back and look at, okay, what happened? How did it work? Are there ways we can improve? And take a calm, measured approach to trying to figure this out. I also think it's important that we tell that story about, I know we've talked about MTSS in the public before, but I think it's also important to talk about the other things that we're doing and the places where we need to go to resolve that so that every student graduates here and can read and write.
But we
So-
need to start working on it before we get MTSS activated in all levels of the district. I mean,
Having that
doing that, but we need to hit the
having
kids that are in high
that
school now.
review can happen simultaneously while we're doing some of these other things. I don't see a problem with that. And your idea, Justin, of bringing it to the academic committee and starting with a comprehensive plan, and reviewing that and trying to figure that out, is certainly a good starting point.
Yeah.
And maybe we'll find that everything in there is good, maybe we'll find that there's some things we want to do differently.
I think, yeah.
Okay. And the other thing is, you know, organizationally, if you just put a comprehensive plan together or whatever, and then you plod off, okay, it may be good for that moment in time, but a year, 2 years, 5 years, 10 years, you have to go through this process periodically to make sure that just because we did it last year doesn't mean that we need to do it again this year, okay? So I think that's a good point and a good place to start.
Yeah, and I think, so I was just writing down some of the things that I know were big chunks. Like I kind of think of things as like big chunks, and once you have a big chunk, then you can operationalize. So like I put down some of the priorities we had in the current plan. So safety and security is obviously going to be a priority, right? That's money is going to be invested in that. So our core programs, our reading, math, and our SEL programs to help build character. And then how do you intervene for students that are struggling either behaviorally in math or in reading? So I think that's what the plan is really based on. And those are really, those have been the priorities for the last, since I've been here.
And Justin, and that may, I'm not disputing that. I don't think Terry's disputing it. But I think the fact that we would bring it up and have that discussion and basically say, yes, this is where we are, this is where we need to continue to go, or these are the changes we need to make.
But the other part of that, the other 20 things that we're doing, are they helping us meet those goals?
Yeah.
And if they're not,
Terry,
It might be helpful too, if you guys bring ideas of like what those kinds of things are, and we can look, we'll bring the plan, you guys bring those things, what are those other things, and then we can, start to take a look.
yeah, so we kind of need to bring this meeting to a close, Cindy. I don't mean to step in too hard here, but we've got several things to talk about as far as our executive session, and I know the Dr. Riggs, I guess, in plural.
He's a mystic.
Okay.
Oh, that's right.
Okay.
I'm sorry. That was my fault.
Okay, have some guests coming here, and we want to try to be as timely in starting our meeting as we can. So,
So we're adjourned.
thank you.
Is that quick enough?
Yeah.